Memedicine Cram Acyanotic Heart Disease, Flashcard Set 20, Eisenmenger Syndrome. All right, so let's just cover a little bit of background. Acyanotic heart disease is a group of heart conditions where oxygenated blood mixes with deoxygenated blood, causing cyanosis, where cyanosis basically means pale or blue-grayish skin due to decreased oxygen in blood, okay? And Eisenmenger syndrome is a specific kind of acyanotic heart disease. It's a syndrome that is a triad of systemic to pulmonary cardiovascular communication, pulmonary arterial disease, and cyanosis. Basically, pulmonary arterial disease develops as a consequence of increased pulmonary blood flow. So you see there's like a hypertrophy in the pulmonary arteriole causing increased pressure. There's like a medial hypertrophy, okay? So again, Eisenmenger syndrome is a condition that includes cyanosis, pulmonary hypertension, that's high pressure in the blood vessels of the lungs, and erythrocytosis, an increased number of red blood cells due to decreased oxygen in the blood, okay? And we see here because of increased right ventricle flow, there's going to be a shunting of deoxygenated blood to the pulmonary, pulmonary arteries or something, to the aorta. And so like there's like a lot of deoxygenated blood flowing throughout the body. So increased flow from the pulmonary artery, like hypertension from that region, causes increased flow of deoxygenated blood to the rest of the body, okay? And when I say shunt, there's a shunt, like there's like a push of blood from here to here, okay? All right, this deck of cards can be used for review for the National Council licensure examination. During a bedside report, the healthcare provider learns that the cardiac circulation of an infant with Eisenmenger syndrome is shunting from right to left, as we previously just saw, okay? The infant may have impaired gas exchange related to A, decreased pulmonary vascular pressure, B, decreased pulmonary blood flow, C, dilated pulmonary capillaries, or D, decreased ventilation in relation to perfusion. I'll give you a moment to select the correct cause of impaired gas exchange. Okay, so basically, when the pressure on the right side of the heart increases, blood in the right ventricle will be shunted or pushed to the left ventricle through a ventricular septal defect. And deoxygenated blood, as I told you before, will mix with oxygenated blood, leaving the heart to be delivered to the rest of the body. As blood shunts from the right to the left ventricle, less blood goes to the lungs, causing decreased pulmonary blood flow and hypoxemia. And when I say hypoxemia, I mean an abnormally low concentration of oxygen in the blood. All right, so the correct answer is B, but if you're wondering what perfusion means, that's the process of the body delivering blood to the capillary bed in its, tissue. All right. There was a lot to digest in this deck of cards.